Becoming a parent is such an adjustment in itself that being thrown into this ICU with so many machines everywhere, medication pumps beeping, the sound of ventilators, and a baby who's very, very sick, it's just kind of a scary environment. And that's why, as a registered nurse in the neonatal intensive care unit, I just always strive to try and make some kind of connection to help the parents bond with their newborn and be involved in their baby's care. Oftentimes, parents of infants in the NICU feel like they're not really the parent yet. And it can be very emotional seeing the babies put through different procedures that might be painful for them. However, parent-infant bonding has been shown to be very positive for the baby, so I think that it really does have the potential to improve long-term outcomes. I first started considering healthcare as a possible career field for myself after I was diagnosed with type 1 diabetes. I realized then how important particularly nurses are in terms of educating patients about their healthcare regimen and how they can take care of themselves when they have a chronic disease. And as an undergrad, I started working as what's called a clinical nurse extern in the NICU. And as I worked there, I realized how the babies all just have such different personalities. I really just fell in love with the unit. Overall, it's usually a very happy outcome. And in the cases when it's not a happy outcome, well, it's hard, but it's also rewarding knowing that maybe you've helped them to make some positive memories and helped them to realize that they really are a family and kind of empowered this family to know that they're the parents and they can make good decisions about how to care for their baby. Right now, there's actually very little training on how to support families who are making these types of critical decisions and provide really good family-centered care. However, through fellowship support, I'm now a PhD student at the School of Nursing. And my dissertation research will focus on this parent decision-making and the role that trust in the provider plays. And I'm hoping that this research will be able to help us form new interventions to improve parent-provider relationships in the NICU. That it might just work better. Yes, it can be very hard working with very sick newborns and seeing how hard the family is struggling. But one of my favorite parts is when we see, all of these babies who I took care of who are now 3, 4, 5 years old and doing really well, and they're just happy and just pretty much normal kids.